any other complications and risk factors, short term and long term, on mother and child for
For
C-section?
cesarean, yeah, you
Okay.
are giving anesthesia to the patient. So whatever little anesthetic risk is there is there. There are chances of infections or excessive bleeding while you're doing the surgery. So those are not much with the fetus though.
Okay.
It's generally done to save the fetus. So
Absolutely.
not much complications that we see with the fetus, but yes, things can, like, these are the complications that can happen.
Okay.
Having said that, in a good setup these days, with so much technology available, with such minute needles for spinal anesthesia,
Right.
cesarean section, if done right at a right place, has become pretty much really, really safe.
Excellent.
Yeah. So that's what it is. So complications long term, again, there are no complications. Yes. One thing is, once you've done one C section, the chances of, whenever you plan the next baby, the chances of you ending up with a cesarean the second time is also high.
Also high.
Yes, it's almost
Okay.
as good as 100%, except
Okay.
you go for vaginal trial after a cesarean section. But the chances are really high. That is one disadvantage of going for a cesarean section, that your next delivery is also going to be through a cesarean section. But otherwise, there's no.
So, from what I'm understanding, when it comes to the fetal point of view, the baby's point of view,
Hmm.
C-section has more advantages
Yes, yes.
because you are basically taking away
Yes.
what is coming in distress.
Yes.
And you are taking care of that.
Yes.
So
yes.
the risk and the complications for the baby becomes
Yes,
negligible
less.
then.
Yes,
Because you're
that's true.
actually C-section is meant to
Save the
remove
baby,
these
yeah.
risks and
Yeah.
not it. That's and what about the recovery period of C-section in terms of time, complications, or physical impacts?
Okay, so yes, there is a scar. So obviously, the recovery time is a little bit more than vaginal delivery.
Okay.
The pain is also a little more for the first 48 hours or so.
Okay.
But beyond the first 3 days, both the surgeries are comparable.
Okay.
So the mobility of the patient is not hampered. The patient is mobile on day 3, doing the routine activities. But yes, with the cesarean section, we tell them to avoid heavy weight lifting for at least a month and a half, because there's a scar on the abdomen. So, barring that, the recovery is a little bit slower with a cesarean section compared to a vaginal delivery.
Okay.
Having said that, it's a normal C-section and a normal vaginal delivery. Like, a vaginal delivery can also have more complications than a cesarean section.
Absolutely.
With a infected episiotomy wound or something.
Okay.
There'll be more rest period and more dressings and more a lot of things if that has not gone
True.
well, right?
Okay.
So comparing two normals, I think cesarean has a little bit longer recovery period.
But it's not like what earlier it used to be
No,
like
no,
because of the
no.
advancement in technology.
Yes, yes.
I mean, this is a better space today.
Post
for
COVID,
both.
I would like to tell you. So before, patients of cesarean section used to stay in the hospital for like 3 days or max 4 days.
Right.
Post COVID and everything that happened and how the scenario changed for medical personnel. Second day, we are okay discharging cesarean sections on the second day as well.
Okay.
If they're living nearby, and
Okay.
that they're going to follow your instructions well. Second day is as early as a vaginal delivery going home, right?
Absolutely.
So post COVID, things have changed, and the recovery is pretty much similar now.